It's my pleasure to be at the Fatty Acid Forum and to speak on milk fat depression and some of our recent data characterizing the time course of induction and recovery of milk fat, which provides insight into identifying the cause of milk fat depression when it occurs and setting expectations when we're rescuing or alleviating milk fat depression on farms. I first wanted to start and recognize that milk fat is affected by many, many factors. We'll spend quite a bit of time today talking about nutritional factors affecting milk fat, but there's also many non-nutritional factors. Specifically, genetics, status of lactation, and season are especially important. These non-nutritional factors come into play when we set the expectations for what milk fat concentration and milk fat yield should be on any given farm. Setting those expectations is very important to being able to identify if milk fat is below optimal or below your goal. In those cases, when milk fat is below, say, the genetic potential of the cow, we normally expect that the nutritional factors are playing a key role, and that's generally the case. So we're going to spend a lot of time today talking about the nutritional factors that affect milk fat. And you'll see a couple times today that things such as dietary fiber, specific feeds, and especially high-fat feeds are important. And also feeding strategies can play a role. Now, these nutritional factors lead to what we call classical diet-induced milk fat depression. And diet-induced milk fat depression is characterized by specific inhibition of milk fat. It's really a neat case where we do not have a decrease in milk yield, we do not have a decrease in protein yield, we only have a decrease in milk fat synthesis. I also want to briefly discuss some of the historical theories of the cause of diet-induced milk fat depression. Low milk fat is not a new issue. It's not a new observation. This has been observed over a century and a half and has been investigated for many years. Many of the early theories on the cause of milk fat depression centered around a shortage of a precursor for milk fat synthesis. People have proposed that there's a deficiency of dietary fat, which was disproven, a deficiency in acetate, which is also disproven. What's interesting is that under many of the diets where we observe milk fat depression, we actually have no change in the amount of acetate, but we have increased propionate, and that's why we see this change in the acetate to propionate ratio is because of an increase in propionate, not because of a decrease in acetate. And then lastly, there's a theory called the glucogenic insulin theory that's based on this increased propionate stimulating insulin that causes adipose tissue uptake of nutrients competing with the mammary gland. We don't have time to go into more specifics on each of these theories today, but I'll say that overall, these theories provide little or no support for a shortage of precursor for milk fat synthesis as the mechanism of diet-induced milk fat depression. So what is the mechanism? Well, the central observations on milk fat depression is that you have altered rumen fermentation and the presence of polyunsaturated fatty acids. And the more you increase polyunsaturated fatty acids, the more you will observe milk fat depression. So there's really a key play between the fermentation that's occurring and the level and type of fat in the diet. We thus say that milk fat depression involves an interaction between ruminal fatty acid metabolism and mammary synthesis of milk fat. So something that's occurring in the rumen is then changing how the mammary gland is functioning. Dr. Jenkins did a very good job talking about the rumen transformations of unsaturated fatty acids in a previous fatty acid forum. But I wanted to just take a minute to review this because it's really important to milk fat depression. So dietary lipids are mostly in an esterified form in the feed. They enter the rumen and quickly go under a process called hydrolysis. And this results in unsaturated free fatty acids that are available for microbial metabolism. The microbes in the rumen are going to try to remove the double bonds in these unsaturated fatty acids through a process called hydrogenations. And we normally call this biohydrogenation because it's occurring through the work of the microbes. This process of biohydrogenation, when it goes to completion, results in saturated free fatty acids, but we also have a number of intermediates in this process that pass out of the rumen, are absorbed by the animal, and end up having an effect in the mammary gland on milk fat synthesis. So we need to take just a little bit of a closer look at this process of biohydrogenation, and we're going to use linoleic as our example. So this is cis9, cis12, C18-2. And biohydrogenation is not a single-step process. We don't simply go from our precursor to our product. We actually go through a series of intermediates. And under normal fermentation, the first intermediate is fermentic acid, cis9 trans 11, CLA. We then remove one of the double bonds and have trans 11, 18-1, and if the process goes to completion, we get stearic acid. So this occurs under normal ruminal fermentation when we have a microbial community that has a high capacity to utilize this normal pathway. However, when we get into altered fermentation, we get a switch to microbes that utilize a different pathway. And this altered pathway results in the formation of a number of different CLA intermediates, but trans 10 cis 12 CLA is one intermediate, and then we remove a double bond and we get trans 10 18-1, but also a number of other trans 18-1 isomers. And then finally, if the pathway goes to completion, we get stearic acid. However, this alternate pathway has a more limited capacity for these second steps, resulting in passage of the CLA isomer out of the rumen. So Dale Bauman at Cornell specifically tested this normal versus alternate isomer, and how he did this is he was able to get purified forms of each of the individual isomers. And I'm showing here the milk fat concentration from cows who were infused with either control, the normal isomer, or the alternate isomer for 4 days. You can see that the control and the normal isomer really don't change milk fat concentration, but our alternate isomer, the trans 10 cis 12 CLA isomer, results in a rather rapid decrease in milk fat. So we reach a nadir or a low point in about 3 to 4 days. And when we stop infusing CLA, we also get a rapid increase in milk fat percent, and we'll normally be back to normal milk fat levels in the matter of 3 to 5 days after we stop abomasal infusion of CLA. So this proves that our alternate isomer has a very potent ability to decrease milk fat synthesis in the mammary gland, and also that the mammary gland is very acutely sensitive to this isomer. It has a very rapid response, and actually in some other time course data we can see the decrease in milk fat occurring within 14 hours after we start CLA infusion. So just to review the mechanism, we have diets that include risk factors for milk fat depression that lead to altered ruminal fermentation. This altered ruminal fermentation results in formation of these bioactive trans fatty acids. These bioactive trans fatty acids then change the physiology of the mammary gland and decrease the expression of the enzymes that are making milk fat, and this results in a decreased capacity or decreased rate of milk fat synthesis in the mammary gland. So what's really important to keep in mind is that we don't simply have a yes-no answer on the normal pathway and the altered biohydrogenation pathway. And what we're illustrating here is this continuum between these biohydrogenation pathways. So we can think of an animal with maximal milk fat all the way down to a cow that has very low milk fat. And if we look at what's happening with the biohydrogenation pathways, when we have maximal milk fat synthesis, we'll actually observe very little cis9 trans 11 CLA, very little of the normal isomer. And that's because that normal pathway has a very high capacity in this situation, and it's going to completion. We're forming stearic acid, and the intermediates are not leaving the rumen. But then as we add more risk factors to the diet and we start slowing down this normal pathway, what we observe is an increase in the normal CLA isomer. We still have reasonable milk fat because this normal isomer is not bioactive in the sense of decreasing milk fat, but we're sort of getting to the edge of having milk fat depression. And then at some point we start actually decreasing the utilization of the normal pathway, and we start increasing the use of the alternate pathway. And we'll continue to increase the alternate pathway until we go into severe milk fat depression. So it's not a yes-no question of which pathway is being utilized. It's actually this continuum. And any one herd or any one cow within a herd is somewhere along this continuum. And this is part of the reason why it seems like we will observe milk fat depression without much prior hints to it occurring. And that's because we will have that herd close to the point of dropping into the alternate pathway. You add that last risk factor and you are all of a sudden moving into the alternate biohydrogenation pathway. So we are really interested in which pathway is being used and what's the capacity of each of the pathways. So to take a mechanistic view of biohydrogenation, the rate and the pathway depends a lot on the microbial population. And we're learning a lot more about the different microbial populations in the rumen, and we'll hopefully learn quite a bit more on which populations are really important to the specific pathways and the rates of those pathways. But what we know is that the selection of those populations is highly dependent on diet fermentability, total unsaturated fatty acid concentration in the diet, and many other associative effects. We don't have time again to talk about each of these associative effects, but such things as monensin or feeding strategies would play into which microbial populations are being selected for within the rumen. We also have to think about the substrate for fatty acid biohydrogenation. So this is the amount of the unsaturated fatty acids that have to be biohydrogenated. How much are we asking that biohydrogenation process to do? So we want to think about the fatty acid concentration and profile, and also the release rate of fatty acids into the rumen. Lastly, we want to think about passage rate. And this is really important because the microbes need time. Remember, if that biohydrogenation pathway goes to completion, we don't have these bioactive intermediates. However, the microbes need time to complete that metabolism. So, one of the questions we had in the lab is, when milk fat depression occurs, when did the problem originate? And to answer that question, we need to know, in diet-induced milk fat depression, what is the time course of events leading to induction of milk fat depression? And then secondly, when correcting the diet, when do we expect to see improvements? And this is really important because when we make corrections, we're going to be watching to see if we fix the problem, and we don't want to make additional changes, especially if those changes are going to lead to loss of energy balance or loss of milk production. So to look at the time course, we utilize two diets. We have a low forage, high oil diet. So this is 29% NDF and 6.9% fatty acids, with fatty acids mostly coming from soybean oil. And then we have a control diet, which is 36% NDF and 2.6% fatty acids. So we designed diets that are quite different in their fermentability and their unsaturated fatty acid concentration. We then milk sampled every other day during induction and recovery to observe the time course. So I'm showing here the milk fat yield when we fed the control diet and when we fed this low forage high oil diet that induced milk fat depression. So we started with rather high milk fats. This is almost 4% milk fat in these cows. And after we see that when we fed this low forage high oil diet, we got a progressive decrease in milk fat yield, which was significantly different from control on day 9 and reached a plateau on about day 13. So it's progressively decreasing, but it's taking this 10 to 14 days for complete milk fat depression to occur. When we look at the fatty acid biohydrogenation pathways, it's quite interesting that during this early period when we did have a progressive decrease in milk fat, we observed a really large increase in the concentration of the intermediates of the normal pathway. So what's occurring here is we're slowing down or having a limited capacity of this normal pathway. And then as the normal pathway starts decreasing, we see that we have this progressive increase in the alternate pathway, which correlates well with the timing of our milk fat depression that's occurring again along this 10 to 15 days is where we're getting complete milk fat depression. We then took those cows that were low milk fat and switched them back to the controlled diet, and we called that recovery from milk fat depression. So here, both groups of these cows are on our control diet, but the recovery were previously on that low forage, high oil diet. You can see that we have a progressive increase in milk fat when we switch to our recovery diet, but that it is still significantly lower than control until day 13. And it's taking really until day 17 to 18 for us to get complete resolution of the milk fat depression. When we look at our biohydrogenation pathways during the recovery, we see that we have this progressive decrease, rather progressive decrease in the alternate pathway. And then in the normal pathway, we do get a decrease initially, but then a secondary rise in the concentration of the normal intermediate of the biohydrogenation pathway. And we're really interested in this second phase, which we think may actually be that the rumen is going through a secondary adaptation and maybe a period where we would be somewhat susceptible to falling back into milk fat depression because that normal biohydrogenation pathway has a limited capacity. So to summarize, following a dietary adjustment, a lag of 7 to 10 days is expected to see milk fat depression, so it's that progressive decrease. Following diet correction, it will take 10 to 14 days to rescue milk fat depression. So hopefully with this it will provide some insight into troubleshooting the cause of milk fat depression and setting expectations for recovery when you make specific dietary adjustments. What's important to keep in mind is that milk fat depression rarely is caused by a single factor on farms. There's many risk factors and they will interact sometimes in synergistic ways, to result in milk fat depression. You can't eliminate all the risk factors, and actually you don't want to eliminate all the risk factors because many of the risk factors are improving energy balance and are improving milk production. So my recommendation is that nutrition is best practiced as an experiment in progress. So you want to make logical changes and then let the cows tell you if you are right or not. Monitor milk yield and milk fat over time to see if you've corrected the problem. What I would do is first look at dietary polyunsaturated fatty acids, both the concentration and the source, because rapidly available unsaturated fatty acids are worse than more slowly released unsaturated fatty acids. I think this is the best first step because you have a lower risk of losing milk fat or losing milk yield, at least in the short term. The second thing to think about is diet fermentability. So analyze carbohydrate profile in effective fiber. Really, experience with similar diets in the region is really, really important. And this is why I can't give you a specific target number for NDF, starch, or effective fiber. It's going to be very different from region to region and herd to herd depending on the type of diets and forage quality. What I do recommend is start to titrate down starch and increase fiber, switch more rapidly fermentable sources for less rapidly fermentable sources, and increase effective fiber. But be careful because you may lose milk yield when you start reducing the fermentability of your diet. Other risk factors include rumensin. Remember, rumensin is a risk factor, but it does not cause milk fat depression by itself. There's also some data in the literature that supports direct-fed microbials in DCAD to have a beneficial effect on milk fat depression, so this may reduce the incidence in some cases. But remember, you're dealing with many interactions, so everything's not going to work every time, so let the cows tell you if you are right or not. The last is feeding strategies, so number of feeding times per day, and feeding times is important. Basically, you want to try to reduce slug feeding, and we can slug feed TMRs if you're really getting large intakes right after delivering fresh feed. And the important thing is to monitor milk yield and milk fat and set expectations for the time required. This isn't a problem that occurred overnight, and we're not going to solve it overnight, but hopefully in the matter of that 2 to 3 weeks. Lastly, I want to recognize a couple folks in the lab who have done a lot of the hard work. Dr. Daniel Rico is a recent PhD graduate in the lab, and Jackie Ying is our technician. We continue to collaborate with Dr. Dale Bauman at Cornell, who is my PhD advisor, and we work in multiple projects in the area of milk fat. And we also have support from USDA in the area of milk fat. Thank you, and I'm happy to answer any questions.